Whether you've been diagnosed with bladder cancer, are a bladder cancer survivor, are someone taking care of someone with bladder cancer, or just want to know more, it is important to get the facts and keep moving forward with hope and determination. So what is bladder cancer? Bladder cancer is a type of cancer that begins in the cells that line the inside of the bladder. It typically affects older adults, however, it can occur at any age. Symptoms of bladder cancer include blood in the urine, frequent urinations, painful urinations, back pain, and pelvic pain. Bladder cancer develops when cells in the bladder begin to grow abnormally. These cells develop mutations that cause them to grow out of control and not die. These cells then form tumors. Risk factors of bladder cancer include smoking, which causes harmful chemicals to accumulate in your urine. Another risk factor is increasing age, however, it is rarely found in people younger than 40. Being white is another risk factor. Being white has greater risks than other races. Another risk factor includes being males, which have higher risk than women. Also, exposure to certain chemicals. Chemicals linked to bladder cancer include arsenic and chemicals used to manufacture dye, rubber, and leather. Taking certain diabetes medication is also a risk factor, and chronic bladder inflammation, such as repeated urinary infections and family history of cancer. Tests include cystoscopy, which is when your doctor inserts a narrow tube through your urethra. The tube has a lens and fiber optic lighting system, allowing your doctor to see and examine the inside of your urethra and your bladder. Another test includes urine cytology, which is a sample of urine which is analyzed under a microscope. Another test includes imaging tests. This allows your doctor to examine the structure of your urinary tract. This test uses a dye that is injected into a vein before the procedure. After you have been diagnosed with cancer, your doctor may do additional tests to determine the extent of the cancer. These tests include CT scans, MRIs, bone scans, and chest x-rays. There are 4 stages of bladder cancer. Stage 1 is when cancer occurs in the bladder, in the inner lining of your bladder, but hasn't moved into the muscular bladder wall yet. Stage 2 is when the cancer has moved to the bladder wall but is still confined to the bladder. Stage 3 is when cancer cells have spread through the bladder wall to the surrounding tissue. Lastly, Stage 4 is when cancer cells have spread to the lymph nodes and other organs, such as your bones. Treatments include surgery to remove the tumor, surgery to remove the tumor and small portion of the bladder, also biological therapy, which works by signaling your body's immune system to help fight cancer cells. If your cancer has invaded the deeper layers of your bladder wall, there may be surgery to remove the entire bladder or surgery to create a new way for urine to leave your body. Preventions include no smoking, steer clear of all things containing tobacco, take caution of chemicals around you, use safety precautions at work, and drink water. Water dilutes toxic substances. This year, an estimated 76,960 people will be diagnosed with bladder cancer in the United States. Make sure you're not one of them.